The best weapon we have against breast cancer is early detection. Here's Dr. Stephanie Graff of HCA Midwest Health with information that could save your life.
At HCA Midwest Health, we have high-risk screening. Women that are at an increased risk for breast cancer will receive a letter or a phone call from one of our certified genetic counselors about whether or not you should be considering something different. If you have multiple family members affected by breast cancer, if you have any family members with ovarian cancer, any men in your family with breast cancer, those are all reasons to start thinking about whether or not you need to have genetic testing. A genetic test is really just a blood draw, which is a really not this big fancy test that some patients I think anticipate that it will be. In the last 10 years, we've had several new medicines approved for metastatic disease that improve outcomes. We've had some drugs looked at for specific genetic mutations, like women who with a BRCA1 or BRCA2 mutation may benefit from drugs differently than the general population. We partner with Sarah Cannon Research Institute and offer clinical trials to the Kansas City metropolitan area and patients traveling in from around the country to participate in the clinical trials. Sarah Cannon has been a leader in clinical research over the last decade. About 2/3 of cancer drugs brought to market have been studied and developed at a Sarah Cannon Cancer Center. There's 3D mammography now, or tomosynthesis, which can really enhance detection, gives us a much sharper picture of the breast tissue. When we're doing screening mammography, we're looking for little flecks of salt in a black and white grainy photo, so having that 3D movie, if you will, to better interrogate the breast tissue really helps us detect it early. The most important part of somebody's diagnosis is the details, and that's a really frustrating part of the process for patients. So it takes days to weeks to put all of that information and get all the details we need to really optimize somebody's treatment. I absolutely encourage lots of questions. I encourage second opinions. I encourage patients to gather up all the information that they can. That's our job as your healthcare team, is to answer your questions. Women have many options when they are considering their surgical options for the treatment of breast cancer. They can choose a lumpectomy, which is just breast conservation, where we take out just the tumor, or a mastectomy, where we remove the entire breast. I think every day we make strides against breast cancer and see new exciting treatments on the horizon, enhances in the technology to help us detect it and treat it earlier. I'm thrilled with the clinical trial options that I have available at our facility at HCA Midwest Health, and I'm thrilled that at every national meeting and every time that a team of breast oncologists is coming together, we're getting more ideas about things we can do together to move the mark.
To take a free breast cancer risk assessment or to find out more, head to hcamidwest.com/breast.